Hello everyone, my name is Raquel Alvarez, occupational therapist, and today we're going to talk about mirror therapy. Mirror therapy was proposed as a potential therapeutic intervention to help alleviate phantom limb pain, a condition in which patient feels they still have a pain in the limb after the amputation. The visual feedback from viewing the reflection of the intact limb in the place of the phantom limb made it possible for the patient to perceive movement in the phantom limb. Their hypothesis was that every time the patient attempted to move the paralyzed limb, they received sensory feedback through vision and proprioception that the limb did not move. In the mirror therapy, a mirror is used to create a reflective illusion on an affected limb, to trick the brain into thinking that the movement has occurred without pain, or to create positive visual feedback of a limb movement. The mirror is positioned so the consideration of the opposing limb appears in the place of the hidden limb. Clinicians can also create this illusion with a mirror box. This device is simply a box with a mirror in the center that permits the hands to be placed on either side of the mirror. The affected limb is always covered, while the unaffected limb is placed on another side, so its reflection can be seen in the mirror. Technique. The patient places the unaffected limb into one side and the affected limb into the other. The patient then looks into the mirror on the side with unaffected limbs and makes mirror symmetric movements as a music conductor might, or as we do when we clap our hands. Because the patient is seeing the affected image of the good hand and movement, it appears that if the affected limb is also moving. Through the use of this artificial visual feedback, it becomes possible for the patient to move or to think that he's moving the affected limb and to release it from potential painful position. Now we will talk about mirror therapy in stroke. Mirror therapy has been employed with some success in treating stroke patients for pain as well as for motor function. Clinical studies that we have combined mirror therapy with conventional rehabilitation have achieved the most positive outcomes. However, there is no clear consensus about its effectiveness. Another recent research concludes that in stroke patients, we found a moderate quality of evidence that mirror therapy as an additional therapy improves recovery of arm function after stroke. The quality of evidence regarding the effects of mirror therapy on the recovery of lower limb function is still low, with only one study reporting effects. Another recent review summarized that the effectiveness of mirror therapy for improving motor function, activities of daily living, pain, and visuospatial neglect in patients after stroke. 14 studies with a total of 567 participants that compare mirror therapy with other interventions were compared. At the end of the treatment, mirror therapy improved movement of the affected limb and the ability to carry out daily activities. It reduced pain after stroke, but only in patients with a complex regional pain syndrome, and the beneficial effects on movement were maintained for 6 months, but not in all the study groups. One of the main reasons that mirror therapy works is to the mirror neurons. These are nerve cells that are activated by performing a movement or by simply watching a movement occur. Mirror therapy provides the visual feedback necessary to help mirror neurons fire by simply seeing the movement. As a result, your brain gets the feedback necessary to spark the rewiring process called neuroplasticity. Benefits of mirror therapy exercise after a stroke include hand or arm paralyzed can improve. Some studies have shown that the most common application for mirror therapy after stroke is to improve upper extremity function. Leg mobility might increase. Although mirror therapy is often used for upper extremities, some studies show that it can also be used to improve leg function, but a bigger mirror will be required for this therapy. Post-stroke pain can be reduced, as there is some evidence that mirror therapy can improve the stroke pain. For example, one study even found that mirror therapy helped reduce post-stroke pain in a survivor 5 years after the thalamic stroke. Activities of daily living may be easier to perform. After a stroke, it can be challenging for many survivors to return to their daily activities. Studies have found that mirror therapy can improve an individual's ability to perform some activities for the self-care. Hemi-neglect may improve. This condition involves loss of attention of one's affected side, although research regarding this is still limited. Sensation deficits can be improved, while motor impairments are often the focus of the mirror therapy for stroke patients. It can also be used to address sensation problems. Mirror therapy is a low-risk treatment option after stroke. It's considered safe and affordable therapeutic intervention and simply involves a tabletop mirror and gentle exercises. How to practice the mirror therapy after stroke? There are some steps to follow to perform the mirror therapy. First of all, place a tabletop mirror over your affected arm and hand, with the non-affected arm resting on the table next to the mirror, ensuring that it is fully in view in the reflection. Make sure your affected hand is out of view. Second, spend a few minutes observing the reflection and getting accustomed to the optical illusion. Third, it can be helpful to think of the mirror as a window instead of as a reflection. This can help further trick your brain into thinking that you are viewing your affected side. Fourth, then begin by practicing simple hand therapy exercise with your non-affected hand. This can include touching your thumb to your fingertips, making a fist and then opening the hand, or turning your palm up and down. Fifth, complete these mirror therapy stroke exercises for at least 10 minutes, working your way up to half an hour sessions. Make sure to keep the eyes on the reflection in the mirror the entire time. It's important to be strategic and repetitive with the mirror therapy exercises. Practicing a specific hand exercise repetitively will help activate neuroplasticity. Accomplish mirror therapy 3 to 5 times per day. Originally, patients might only be able to observe the image of the mirror hand and perhaps make small movements. With the time, we'll try to make more extensive and smoother movements with both arms. The initial sessions may be quite short, maybe just 2 or 3 minutes, but gradually improve the duration of each session. Once the movements feel quite easy, do the exercise in different situations, such in a noisy room or when the patient is tired. Thank you so much.